He has over 2 decades of teaching, clinical, and administrative experience. He's presented at over 150 workshops nationally and on 4 continents. He was appointed to the American Psychological Association Joint Task Force for revising the professional practice guidelines for working with sexual minority clients. And he was recently profiled by GLAAD and Voyage LA for Soul to Soul's work with couples and families. He is also a poetry writer and has been published. And it is my honor to be able to present to you Dr. Gregory Cornelius. Doc, the floor is all yours, sir. Thank you for joining us
Thank
today.
you, Patty. Thank you. Thank you for having me. So I'm going to ask you if you might be able to share the copy that I sent to you.
Yeah.
Is there some technical difficulties on this side? Zoom is not always my friend. Sorry to say. I have my copy over here, but if you can open your copy up, that would
Okay.
be
Yes. Of the PDF.
the PowerPoint that I sent this morning.
Yes. Okay. Let me grab that for you, sir.
Okay.
Let me open it. My
How is
file.
the conference going so far?
It has been really good. Thank you.
Good. Good to hear.
Let me grab that. I am going to go.
Intersectionality, risk and protective factors, the coming out process, family of origin and cultural factors, faith and spirituality. We'll do a clinical vignette, and then we'll talk about strategies for supporting LGBT couples, key takeaways, and Q&A. So I am open to having questions as I go along, if that is okay with you all, or we can wait until the end. People can put them in the chat, and I can look at the chat if that is a better option. Sometimes when we do open conversation, I don't always get to everything. So I'm open to whatever you'd like to do.
Well, sorry, it sounds like you want it to be more interactive, so we can monitor the chat and the Q&A. And so as
Okay,
those come in, we can pose those to you, and so we can have more of a flowing interactive session. Does that sound
that
like
sounds
what
good.
you would like? All right.
That sounds good. And I think because there's the lack of the PowerPoint, that's going to be how it should be anyway. Again, I think everything unfolds as it should. So we're going to deal with it that way. So I appreciate that. Thank you, Doctor. All right. So roadmap. We're going to spend. Oh, there it goes. Great. Thank you, Patty. We're going to spend some time talking a little bit about an overview of LGBTQ folks in the U.S., health and mental health outcomes, and the role of faith-based organizations. So just briefly, like this is not doing the whole history of LGBT people in the US, but folks have a diversity of experiences across demographics, things like ethnicity, gender, SES, sexual orientation, disability, religious and spiritual beliefs. All of those things I think are important to think about when we work with the clients that we see in practice. Health and mental outcomes, we'll talk a little bit about that and how minority stress impacts that. And then the role of faith-based organizations. I spent a lot of time doing presentations. Patty mentioned that I've done like over 150 presentations. Quite a few of those have been on religion coming out in communities of color and how that impacts people's daily lives and as well as their relationships with people within their family of origin and outside of that as well. So before we move into that, I want to do like a life mapping activity. We're on page 4, Patty, or slide 4. So I'll ask you to name 1 or 2 significant life experiences, personal and or professional, where you felt accepted by a group. And then I'll ask you to name 1 or 2 where you did not feel accepted, you felt rejected by a group. And you can just jot those down and we can put those in the chat and have a discussion around that. So a few minutes to do that.
And if you would also like to raise your hand, we can unmute participants who would just like to go ahead and speak with us. Does that sound okay with you, Dr. Cornelius?
Absolutely. So maybe 1 or 2 minutes to do that. Write down significant experiences, again, personal or professional, where you felt accepted by a group, and then 1 or 2 experiences where you felt rejected or not part of a group. Any responses?
I think our members are still, we do have
So
one.
Johnny, okay,
Felt accepted in a group when I was in my 20s and joined a group called Out Youth in Austin where I met other people in my community.
okay,
Thank
good.
you for sharing.
Thank you for sharing that. Good. Any others where you felt accepted?
Yeah, I'll share also. I have really felt accepted in the Arkansas Counseling Association, and just being able to be very forward in
Mhm.
expressing needs and sharing concerns.
Oh, that's wonderful.
Uh,
Great.
we do have another comment. Might be
Okay.
both getting married and having kids, feeling accepted, but also I was older than most, so I felt a little out of sync.
Okay. Okay. Good. Thank you. Right, and any experiences where you did not feel part of the group? I'll give you a few minutes to write that down.
I see a number of my former students in here, so you can call on yourselves if you'd like to share, or I can help you. And we see a hand. All right, Jamie, Renee, I'm going to allow you to talk and you can unmute yourself.
Okay. I can't figure out how to get my typed messages across to everyone. So can you hear me?
We can, Renee, go
Okay.
ahead.
Here you.
Okay. Um, I guess my major, one, so I'm blind and often I feel rejected because so much of our world is based on what we can see. Um, Even before hearing or any of our other senses, it's based on what we can see. So, and I wouldn't say really rejected, just kind of left out sometimes.
Mm-hmm.
Um, so yeah.
Okay. Thank you for sharing that. Thank you for sharing. Others?
I know I shared mine. I certainly didn't feel accepted when I was in elementary and junior high.
Mm-hmm. Was there a specific reason for that?
Uh, yeah, I was the smallest, and my parents were divorced during a time
Mm-hmm.
where not a lot of parents were getting divorced. So,
Mm-hmm.
you know, I was kind of the odd one.
Okay. Okay. Thank you for sharing that as well. Any others before we move forward? Okay. So you did exercise. I'm going to ask you to just keep that in mind as we go through and talk about the minority stress model, because that it really focuses on experiences where people don't feel part of the group, don't feel accepted, and how that plays out in their internal world and in their larger interactions with people. So the minority stress model, which is I think one more slide beyond this one, describes stress processes that include experiences of prejudice, expectations of rejection. So, for example, like family, ethnic community, religious organizations, or community, hiding or concealing identity, internalized homophobia or heterosexism, depending on who you talk to. There may be describe it one way or the other. And then stress ameliorative factors. So how people deal with stress and how they move through the world in a more positive way. So when we think about the minority stress model, we also want to talk about intersectionality. To the next slide. And this is a term coined by Kimberly Crenshaw. Most people are familiar with this term. How many people, by show of hands, are familiar with intersectionality? So Crenshaw coined this initially to talk about women's experiences, and particularly women of color's experiences with multiple identities and how those identities are affected and how those identities show up in their everyday life, show up in their interactions at work and home, in the community, etc. But it's come to be used widely, I believe, in other areas with other forms of marginalization or minority experience. So disability, race, ethnicity, gender, sexual orientation, all of those things I think are now thought about in terms of intersectionality. Questions or comments about that? All right, so I think also it's important to talk about risk and protective factors, which is the next slide. Protective factors can reduce risk and contribute to increasing health and well-being for children and families, certainly for couples, all of the folks that I've worked with. Risk factors can reduce the health and well-being associated with disease and injury. And we're going to talk a little bit more about that, including like the coming out process and how that can be a protective and be a risk factor depending on where the person is with regards to the coming out process. Next slide. So LGBT individuals often are at greater risk for these things. So suicide attempts, more than 8 times likely to commit or attempt suicide than their heterosexual peers, more than 6 times likely to report high levels of clinical depression than their heterosexual peers, more than 3 times likely to use illicit or illegal drugs, and then 3 times as likely to be at high risk for sexually transmitted diseases. So all of these things are risk factors associated with being LGBT. And much of it in the work that I've done with individuals and couples and families who identify as LGBT is around the minority stress. And these are reactions or coping styles that are maladaptive that you oftentimes will see in the community. Thoughts or questions about this? Okay, so let's spend a little time about the coming out process. And most people are familiar with the coming out process, have heard about it, or know people that may have gone through it, or maybe even assisted people through it. But I think it's important to go over it again, at least briefly, because it is important, especially in the vignette that we'll be talking about later in the session. So coming out is oftentimes seen as a developmental task. People disclose one's sexual orientation or gender identity, and it can occur over the course of the lifespan. So it's not something that is linear. There's a model that we'll talk about in a few minutes that initially proposed this as being linear. We found, though, after years of research and clinical research, and then also anecdotal case studies, that it really is not something that is linear. People can move forward with their identity and they can move backward. If they are out in one community and they move to another community, and they encounter people that are much more conservative, they might move back into the closet, so to speak. So it's a developmental task, and it can inform healthy growth and well-being. I think the more people are out, at least in my experience, and I think the literature bears this out too, the more they're out and open about their orientation, the more happy, the more fulfilled they are in their personal relationships, in career, etc. And that would, to me, make common sense. I don't know if it's always common sense, though, in my experience is not always common, but I think common sense will tell you that. Not everybody comes out formally. I know people personally and professionally that are still not out in communities and families for some of the reasons that we'll be talking about today. And the coming out process is seen as a healthy developmental task, and it's important to support that with the clients that we work with. Right, next slide, please. So stages of coming out for sexual orientation. This is based on the Cass identity model, which is proposed in 1979. It's one of the most well-known models. They're more contemporary models. I use this model because I think it's the first model. There are models that have been updated that include other things, but this is the model that I was referring to earlier when I spoke about it being considered linear. So the first stage is self-recognition as gay. So the person recognizes that they're gay. They do this usually internally. For different folks, it can be different time frames. Sometimes people are coming out, people I'm working with now that are coming out in their early 20s. I've also had some experiences with kids when I was working with adolescents who were coming out like 12, 13, 14. So it just really depends. There are people that also come out in like age 40, 50, 60. depending on their life circumstances. The second stage is disclosure to others. And so telling people that are allies or friends, coming out to them and being open about it. Usually people pick folks that they think will react positively. Sometimes I've worked with people who don't pick the right person, so to speak, and it can create some problems for them. But disclosure to others is the second stage. The third is socializing with LGBTQ peers. And this is where I think we're very helpful in working with people who identify as LGBT and are coming out initially. This is where I think if you are well connected to the community and to resources, that we can be very helpful for them in getting them connected to community. I live in Los Angeles. I don't know if people are familiar with like West Hollywood area, but the West Hollywood area is very well known for working with LGBT. It's a highly populated LGBT area. A lot of LGBTQ live in the area because it's supportive. There are bars, clubs, restaurants that support it. People can feel like they can walk around and express public displays of affection and not be ridiculed for it. So that I think is really connected. It's really important for us to know those resources, that we connect people to those resources. I work with children and adolescents too, coming out. And so it's important to connect them to peers their same age. There are groups in LA and in larger cities that have support groups for people who are coming out, particularly younger folks. And it's good to connect them to that. So in socializing, it reduces some of the stigma. It helps people to become much more comfortable with who they are, etc. And then the next stage is positive self-identification. So coming to terms with sexual orientation, your identity, and then moving forward from there. And then the last stage is integration and acceptance. And so that means taking all of this stuff that you've learned about yourself, about the community, and integrating that and becoming accepting of one's sexual orientation. Questions or thoughts about that? You usually get questions here. Okay, no question?
So
okay.
Once again, if you guys have a question, please raise your hand. It can be a lot faster than trying to type it in. So we are monitoring for raised hands.
Okay. I can't see that. So if you could.
All over it for you, Dr. Kanias.
Thank you.
But
okay.
I really do appreciate you sharing the coming out model, CAS's identity development model. Some of my students are familiar with this model, or maybe they've forgotten, but I think contextualizing people's development and where they might be at based on these cases really helps put into perspective some of the situations that they might be going through, especially as far as accepting identity and understanding that.
Thank you for adding that. Yes, I agree. And again, I think what we know about this model and other models is that it's not linear. And so when it initially proposed in 79, it was thought that people moved through the 5 stages, and then you got to integration acceptance, and then everything was okay. But we know that that's not always the case, that the people might go back into the closet even after they've integrated and accepted because of the current social environment. So I don't want to get too political, but politics is oftentimes the experience of people who are marginalized, such as LGBT, ethnic minorities, etc. But in the past 4 years, we've had a White House administration that's not been very supportive of people of color or marginalized people, despite what the president says. So the president, it's been, I was about to say rumor, but it's not rumor. They've actually said this, that he's the most gay-friendly president in all of history. So I can't see y'all, so I don't know what your reaction to this is, but I can tell you that that's not the case.
If you can see me, Dr.
I can see you, yes, but I don't know how many other folks are in the room and I don't want to mess with this. So
right. And I appreciate all of this because, again, I work with a lot of individuals in marginalized communities, particularly transgender. And I know for a fact that, this is not linear. It's very fluid. And
Mhm.
here in the recent months, very specifically, there has been a lot of trepidation and a lot of struggle.
Hmm. Yeah, because of the social unrest, because of the president's handling of the pandemic, all those things I think are related. And so I think we have to have discussions about that when we're dealing with a client, when we're working with our clients, because they're dealing with issues that are political. I was once taught a class on ethnicity and mental health, and one of the students in the reviews that we get for faculty, you'll know this, of which I speak. One of the students wrote, uh, "Professor perseverated on political issues for most of the course." I'm like, what are you talking? It's multicultural mental health. Like, it's connected. The political is connected to how people who identify as ethnic minority, disabled, all of the marginalized populations, all the political stuff affects how they move in the world. It affects their day-to-day life. It is minority stress. So those things are important. So with the current administration, I would not be surprised that there were people who moved from integration to acceptance, from integration and acceptance back throughout the stages and went backwards because it was not necessarily a positive for many people. It's
Doc,
anti-trans. Patty, you were talking about working with trans folks. He's very anti-trans. Lots of the policies that he enacted were anti-trans. I have people that identify as LGBT, as LGB, and who were like, "Oh no, he's not anti-gay." I'm like, "What are you talking about? He's anti-trans." Well, that's different. They're not part of the community. I'm like, "What are you talking about? They're the T." Who told you that you can decide who's part of the community? But I believe if he had been elected again, that we would see other stuff around the LG and B that would be negative, and then people would be quite surprised that they supported him. But for example, marriage equality. Marriage equality is only 5 years old. The current Supreme Court is stacked towards conservatism. I don't think that that would have been a good thing. So all of these things are connected to what we're talking about in terms of the minority stress model. Does that make sense?
absolutely. And Doc, we missed something earlier that someone shared that I had tried forwarding to you as well.
Uh-huh.
We had and I apologize. Apparently, my screen is very touchy today. But we also had a individual who had shared that they they had moved from another continent and
Mm-hmm.
a different language and culture. So,
Absolutely.
you know, I think that that's a big thing.
That is a big thing. Yeah. And so people can feel left out of community when that is the case. They can be and they can be embraced if they find communities that are similar. But it certainly can be an experience that is a negative experience if you're in the minority in terms of linguistics. I agree. Thank you for sharing that. Okay, so next slide. So when we talk about like family of origin and cultural identity, I think that that's important to have conversations around that as well. I spend a lot of time in the work that I do with Soul to Soul, working with couples and talking about family of origin. I think family of origin stuff is really impactful. Probably most of you who are therapists would agree with that. I don't think that it's oftentimes paid as much attention as it probably should be. Having taught the clinical practicum for 20 years at one institution, I don't think that people always take the best histories around family of origin and then are unclear about why people are having some of the experiences that they're having. So I've had people talk to me in clinical practicum about clients coming out and they leave it at that. It's like, well, what was their process like for them? Did their family accept it? Were they not accepting of it? What about the community? What about the religious community? People oftentimes will leave out religion entirely, which baffles me because even when people are not practicing religion, most people have grown up in homes where it was practiced and it had some effect on them. And I can tell you tons of stories about clients who were sitting in a room together talking about this and like, I don't practice at all anymore. I don't practice my religion. largely because of experiences that they had that were negative. But I don't think that's affecting me. Like, how is that not affecting you? You're telling me things that show me that that is something that has impacted you, whether it's being really angry about it and not wanting to have conversations around religion and spirituality, or telling stories about not feeling welcomed in their religious community. And that happens more often than not. Uh, I have a very strong faith background. My mother was a lay minister in the Methodist Church, and we grew up Baptist. And I don't know if folks grew up Baptist, uh, Southern Baptist, but you know that is something that stays with you, whether you practice it or not. And I can say that religion has played a really important part. It's the protective factors we'll talk about in a minute. But I have, can tell you about recently, like posting something. I have the family Bibles. Both my parents are deceased. I have both of their Bibles, my own Bible, some hymnals and things like that. And I posted a picture on social media for Soul to Soul about that and it being a protective factor. And some of the comments I got were extremely negative. Like, why would you post this? Don't you know, like, the experiences that people have had with religion and they're negative and this and that? I'm like, that's your experience. And I honor and respect that. But I also think that it can be a protective factor. I don't care what you think. Basically, like, was not having it. I don't care what you think. It's not something that is protective for me. I'm like, that's something you probably need to work on. But I don't think that particular person was open to hearing that. So those things like culture and family play extremely important role in the work that we do. And again, I don't think that it's oftentimes assessed in the way that is most helpful for clients. Does that make sense? Questions, comments about that?
I don't
Could
see
you
any comments, Doc, but oh, nope, go ahead. So sorry.
Okay.
No problem. I just wanted to, if you could explain a little bit more when you say it's not assessed enough, could you expand a little bit more?
Yeah, so I was trained by the Department of Mental Health in Los Angeles County. The Department of Mental Health, to me, has the most comprehensive assessment tool that I've seen. I worked in community mental health. If they're not contracted with the Department of Mental Health, they create their own assessment, and those assessments are not quite as thorough. So when I train folks, when I teach like clinical interviewing, or even when I'm teaching like couples classes, I actually I would have to say every class I teach. Let me say that it's not just clinical practicum or assessment, because I've found out over 20 years of teaching that somebody is not teaching this well enough. And so when they get to me in clinical practicum and I'm asking questions about background that they should be able to answer, they have not done a thorough assessment. So they've not asked the questions that are taboo questions, like sexual orientation, religion and spirituality, race and ethnicity, finances, SES. They kind of just gloss over those because those are things that most of us grew up believing were taboo topics. Then we're told never to ask about people's sexual orientation, those hush hush conversations, if there were conversations at all. Don't ask about people's money. Don't ask about people's race and ethnicity, or just don't talk about race and ethnicity at all, which is obviously problematic and part of the reason why we see what we see now in terms of the Black Lives Movement, et cetera. So those conversations, I don't think people do a really good job of assessing for. When we talk about race and ethnicity, people look at the person and make assumptions. And I will always say to people, I use myself as an example. I have two ethnicities. Patty, I may have told you this, so you can't play along. But other people, I allow people to guess, like, what are the two? What two do you think are my ethnicity? And I will not be offended. You can toss them out.
Afro Latino.
Afro Latina. Okay, you got one.
I got one.
You got one. Which one do you think you got right?
Well, your last name is Canez, so I'm leaning more towards Latinx.
That's what I get a lot. That's not the correct answer though.
Oh. So now we know. So African American heritage back in there.
Okay, so African American. All right. So there's one other. And when you say Latinx, or if anybody else says it Latinx, well, I've given that away. I usually have people be more specific about that. But
You
somebody
took me out of the running, so I'm just sitting back.
so someone said Latino, somebody said Puerto Rican. I think I told you, Patty, right?
Yes, you did.
Yes, you can't play.
I know.
So I got Puerto Rican, I've gotten Latino. So I get that all the time. Like when I've gone Caucasian, Ecuadorian now. When I've gone to Spanish speaking countries, people will speak Spanish to me. So I'll go to Puerto Rico. I've been to Puerto Rico and people will speak Spanish. And when I don't speak Spanish, they're like, what's wrong with you? I was in Spain one time, I was in an airport in Spain, and my whole name is actually Spanish. I wouldn't tell you, but first, middle, and last. And the person looked at my passport. She was checking me in, and she started speaking Spanish. And I was like, Inglés, por favor. And she liked to almost curse me out. She was like, you can't speak Spanish with this name? I'm like, no, I can't. Dominican Republic, they speak Spanish to me because I fit within the color range of those countries. So not Latino, not Latinx. Other guesses?
Caucasian, Ecuadorian, Puerto Rican, Latino.
Yeah, no.
Yep. No others so far. Anyone else?
No others. There's going to be a prize at the end. I'm just kidding.
Guess your flavors.
No others. Okay. So
Asian. Somebody just said Asian.
Okay, Asian. You have to be specific though, like that.
Okay.
Yes.
Yeah.
Somebody want
like the broad ranges. Asian. With
Indian.
Thai.
Asian and Indian.
Hmong.
No.
Korean.
What
Japanese.
other ones?
Filipino.
Korean, Japanese now. Okay, Filipino. Yes,
It was me. I was just going through them out now. We're just going through them. So you're Black and Filipino.
Yes, Black and Filipino. So that explains the Spanish name, the Spanish last name. The Spain
Yes.
and influence the Philippines. But so that's my point exactly. Like you can't tell by looking. I've gotten Jewish, I've gotten Italian, Irish, Middle Eastern, all of the Latinx categories that we went through, of the Asian categories, though Asian usually doesn't come up and people don't usually guess Filipino unless they're Filipino. That's just been my experience. And I don't think that it's, best answer is human being. Yes. However, I think that's true. However, I think that we want to also keep in mind that people's culture is important to them and it contextualizes their experience. So we do want to know about it. We want to ask about it. But first and foremost, you're correct. You are a person first, but culture and all these other diversity characteristics that we're talking about are important in terms of making up the person's experience and how they move through the world. So my point is with that exercise is you cannot look at people, you have to ask people as questions. So my students oftentimes will overlook that. They won't talk about that. They won't ask about sexual orientation. They'll make assumptions about that. They'll make assumptions about religion and spirituality. They won't ask about that. If people have long-standing histories, they won't talk about that at all. I had a student who presented a case on a 80-year-old African-American man who was born in the South. And she said to me, I said, well, what was his history like growing up? Well, he won't talk about it. I'm like, okay, and you just move forward? Yeah, I didn't want to press him. Like, he would have grown up in like the Jim Crow South. Like he would have grown up in the area that my mother and my aunts and everybody grew up in. They were from Louisiana. And we all know the history. I don't need to go through that, of people of color in the South. It's not always been good. So it's changed quite a bit, obviously, but if you're 80 years old, you probably have some experiences that you need to process and talk about. So those kinds of things, I think that they don't really pay attention to. And that's part of the reason for this presentation. And again, I thank Patty for inviting me because I think that this is not always discussed. And this is timely that we're having these discussions now, given what is happening in the country. Any questions, comments?
Yeah, I actually do, because I do appreciate the fact that Shanice brought it up, is what specific format do you encourage your students to use, or do you provide it for them, due to seeing the fact that people don't necessarily do a good job of doing a really good formal assessment
Mhm.
on family and all of these factors.
So
Do you
I
have?
trained them directly on the tool that I was trained on. It's the DMH site tool, which I can send you later, the link to it, so that you can see what it is that I'm teaching them. But we use that tool because it's the most thorough that I've seen. I mean, there are other parts of it that assess other things too. Like it's very specific about suicidal ideation, very specific about drugs and alcohol. It's not just like one question. There are many questions that you have to ask the client. The assessment probably takes about an hour and a half, a good assessment, using that tool. And of course, you don't always get all of the information in the first assessment, but it gives them a good framework from which to work, and they're better clinicians for it. And they've told me that when they are in their practicums and internships.
Somebody just
I'll,
asked.
I'll send you that. If I forget, Patty, if you can remind me. And
Yes, and somebody just
you,
asked if you could repeat what the assessment is called.
it's you'd have to look on the LA County Department of Mental Health. Um, they have a section called clinical forms. Oh, somebody put it up. Okay, somebody found it. Thank you. Yeah, just click on that and you can pull that up and you can look at it. I don't think that they would mind us biting biting their off of their work. But it is honestly, it's the most thorough that I've seen, and that's why I will train my students on that, regardless of the class. It's almost always that we start with that. I said assessment, and I said probably psychopathology, but I really do that with all the classes that I teach because I don't think that they get it. I just don't think that they're getting it based on 20 years of teaching.
Well, we certainly thank you for sharing that with us.
Oh, you're welcome. You're welcome. All right, so cultural identity LGBT, I think we've kind of covered most of this stuff. So many clients who identify as LGBT often have difficulty coming out in their communities. They're negatively affected by community and cultural standards like religious beliefs, again, stereotypes, things that people say like faggot, dyke, tranny, queer, maricon, it's just Spanish for faggot or gay. And so for these reasons, most people just do not come out. Again, I told you that there are probably many people that I've worked with who are still not out and they're well into their 50s, which then creates psychological issues, whether they want to acknowledge that or not. So let's spend a little bit of time on spirituality and religion and faith, because this is a protective factor. We were talking about earlier when the early slides was about protective factors and factors that were not good. So religion can be both protective and it can be a factor that is a negative, depending on the person's experience. But most of the literature supports spirituality and religion. And so this is another area that they do not do really good at assessing. But this is a religious country. It was founded on those ideals. Republican Party, not probably the current Republican Party, but for the most part, the party of Reagan and Bush and all that really have a strong faith-based background. Whether we agree with that or not, that is part of their belief system. And so the country, again, whether people practice or not, it is an important aspect of people's lives. So it can be, again, a protective factor, it can be a risk factor. Next slide, please. So again, spirituality is seen as a dimension of wellness. I think I did cover that, so we don't have to really spend a lot of time on that particular slide. And I've done a lot of research on spirituality and its connection, not just to LGBT, but in general, because part of Soul to Soul's mission is not just to work with LGBT couples, but to work with all couples around this. And I use something called the SYMBIS assessment, which was created by two psychologists. They're married and have a very strong spiritual base. And that's part of the assessment tool that we use. And so it's used, I use that, I talk about this with heterosexual couples in addition to LGBT couples. And most people want this to be part of their life. And so there are questions and discussion around that when I do premarital counseling. How will this show up in your relationship? Do you pray together? Do you go to church together? Are those things that you're planning to do? Are those things that you're not planning to do? Does one person feel that strongly about that and the other person not so strongly about it? But all of those things I think come into play for folks and have to be part of the discussion. So just in terms of general stuff in the research too, that I've done a lot of work with infidelity, and there is research to support that church attendance reduces the likelihood that there'll be cheating in relationships. So it goes back to what many of our mothers and grandmothers said, get you somebody in the church. You want a solid marriage, get you somebody in the church. Now we know that can be both true and not so true. That there are many ministers who oftentimes are themselves not following their own religious guidelines around infidelity and faith and fidelity, I should say. So you have to take that with a grain of salt. But there is evidence to support it being really important in people's lives. All right, so the next slide, I believe, is a recap. So, when we think about this, we think about the person and things like identity, attitudes, perceptions of self, developmental tasks, and acceptance and integration. We also think about behaviors like wellness behaviors related to acceptance versus rejection. We want to have conversations around protective factors and risk factors in the coming out process, and then also think about the messages that people receive from their environment about belonging and membership. So are they isolated, are they belonging? We know that a protective factor is people who are connected do better mentally. Their mental health is stronger when they're engaged with folks. So it's interesting that we're having this conversation in this pandemic, because I've had a lot of conversations around this topic myself with students and with friends and family. So I don't know what the outcome is going to be for the mental health wise for those of us experiencing the pandemic. I think that there's been a lot of stress, a lot of, I think, more increases in depression, increases in substance abuse issues, increases in anxiety, and just around like the pandemic, and then around job loss, and then all this stuff comes into relationships and is a stressor. So I know lots of people who I used to refer folks to who want to see people in practice now that are completely full. And I don't know if that's your all's experience as well, and maybe we can have a discussion about that. But I think we're not doing as well as we could around that, knowing that that is a protective factor for people to be out, to be around people. And we see people constantly. We see now news that there are increases in the number of cases of COVID-19 in the past week or so. And I think a lot of that has to do with people being fed up, being locked up in the house, and not being able to be social. We're social animals, and I don't think that that's being addressed by either party appropriately. Thoughts, reactions to that?
I can't get to my unmute. All I can do is absolutely agree with it. I mean, I myself, being in private practice, can say that there has been a significant increase in both couples counseling as well as individual counseling because of the intensity of not being able to connect in the ways that people normally do, and maybe being around people they would normally enjoy, but too much so that now they don't know how to communicate well.
Yes, exactly. Yeah. So there was, for most couples, there was some time apart, because even if one person's working, one person's at home, there's some time that they're not together. Or if both people are working as a dual income family, both are out and doing things. And now that you can't really do that, people are on top of each other, and it's created more stressors. And you may love the person, but it's like, you know what, I don't want to see you all day. That's been my experience when listening to couples talk. It's like, I need a break. And so creating space for that within the same house, I think, is really good, because you are on top of each other, and that is a stressor in and of itself. And then if you add kids to the mix, and there are lots of couples that I work with who have children as well, who they're homeschooling now, It just makes for much more stressful life than what we are used to. But I don't think that that's really being addressed appropriately. Kudos to all the people that are seeking mental health, and there are quite a few, as I can confirm on this side as well. Patty, you and I talked about that, and I know you had an increase in your practice, and for the folks that I know who are doing that as well in private practice, and even in community mental health, there has been an increase in the number. And even with groups who historically do not seek mental health, they're now. So in some ways, that might be a good thing because people are forced to do this that normally would not do it. Any other thoughts, reactions?
Yeah, just somebody else had also agreed with that as well in
Mm-hmm.
chat.
Good. Okay. Thank you. Okay. Thank you, Abby. Okay. So if we have some time, we would like to do the vignette. So I think might be the next slide.
So what I'm going to do is I'm going to share that document of the case for your vignette.
Thank you.
It is in the chat now, but also I'm going to share my screen where I have, Patty, please stop sharing. Oh, here we go. And we're going to pull up the vignette. So can everyone see the vignette?
Thank you. So usually on ground, I would have folks break out into groups to do this, but I don't think we have the option of doing that right now. So if you will take probably about 10, 15 minutes to go through the vignette and then answer the questions, and we'll come back and have a discussion about it. How does that sound?
And I'll read the vignette as well. I know we have a participant who's visually impaired, and so I'm going to read the vignette
Thank you.
because I don't know what her system is doing. All right.
Thank you.
So, clinical vignette. Dwayne, a 35-year-old African-American male, and Ruben, a 26-year-old Latinx male, are referred to therapy by a family friend. They have been in a relationship for approximately 18 months. Dwayne works for a large corporation and his time is frequently taken up by building his career. He spends a lot of time in his office and is not out at work. Dwayne's job requires a great deal of socializing with coworkers and current potential clients. At some of the social engagements, employees are encouraged to bring their spouses or significant others, such as the annual Christmas party and 4th of July picnic. Dwayne does not feel comfortable bringing Ruben to these events, and it has been the source of many arguments between the couple. Dwayne is also not out at his large family, whom he describes as very religious. He also reports that he does not feel comfortable with public displays of affection when they are out on outings, unless it's within the LGBTQ friendly areas of the city. Ruben is a full-time student. Ruben is currently in school working on his degree in nursing. He reports spending his leisure time hanging with friends, going to clubs and bars. Ruben is out to his family and friends. He enjoys socializing with other LGBTQ individuals. He admits to being a social drinker and occasional marijuana smoker. The couple has come to counseling because Ruben recently admitted to being unfaithful. He reports that he met a guy at a bar a few weeks ago and hooked up with him a few days later. He recently admits to having cheated in his previous relationship, which ended shortly before he met his fiancée. Dwayne is upset about the infidelity and is considering ending the relationship because he thought he was in a monogamous relationship, and that doesn't seem to be the case. Ruben reports that he made a mistake and states that he will not cheat again. The first question that we would like you to reflect on is, what additional information do you need to gather about this couple? So I'm going to stop sharing. And maybe if everybody has any thoughts right now on additional information that they would like to gather, you can raise your hand and we can share those.
Thank you.
So the fiance in this story, Dwayne and Ruben are fiancés. They've been together for approximately 18 months. And Ivy says that they would like to know more about the family background for both in regards to culture, religions, etc.
Mm-hmm. Good, good. Because we don't have a lot of information about that. Okay. So how does the culture affect them? Does it have anything to do with acceptance or not being accepting sexual orientation and then being equal? Religious practices, all of those things I think are really important. Good, thank you.
Yeah, what about family support has been asked.
Mhm.
Abby Kate, our current secretary, as I've allowed you to talk so you can put your 2 cents in, Abby.
Well, thank you. Um, I think there are a ton of questions I would like to know more about. The religious family
Mm-hmm.
for Dwayne. I
Mm-hmm.
think I would also like to know more about the history of Reuben, because if one partner is out and the other one is not, there seems to be a lot of gray area in their relationship and where they think they're headed.
Mm-hmm. Yeah, I would agree with that. Yeah.
Family support as well.
Mm-hmm.
There's just a ton of things I think I would dive into.
Mm-hmm.
Lots of family history kind of issues, family of origin. Also social. It doesn't seem like they enjoy doing the same kind of social things. So
Mm-hmm.
a lot of relationship history as well, I think would probably have to go into it for me also.
I would agree on all of those points. Yeah. So what are their relationships like? What are previous relationships like? Ruben discloses that he had cheated before, but was that the only time? Was that with that previous relationship? Did he do that in other relationships? What was Dwayne's relationship like? I agree with the social support and family support. We again know that those things are protective factors if people are supportive. The out status, you're correct in that. I think we want to know more about that. One person's out and the other's not. What kind of stressors does that bring out for them? It seems to be problematic from the vignette that one person is out and doesn't feel included in his fiance's work or family events, and that can create a stressor, which I think a lot of times couples that I've worked with don't understand how that's stressful. But if you can't really be fully a couple, and these are issues that most heterosexual couples do not have to encounter, how does that show up in your relationship? How does it impact that? Does it impact trust? Does it impact vulnerability? All of those things. So I think we also want to look at it at a deeper level. Thank
I also think it, even brings up the dynamic when I'm conceptualizing it, where
you. Mhm.
Dwayne isn't out, but Ruben has cheated before and he is out. Is that feeling of not being accepted by the person who says that they're in a monogamous relationship? But if
Mhm.
he's cheated, is it because there is that fear of being abandoned and therefore maybe self-sabotaging?
Mhm. Good. Good. Yeah, and that's oftentimes related to family of origin stuff. Done a lot of work with infidelity. And a lot of times people will blame it on the partner. It's like, you're not present, we're not having sex enough, all of those things. But when you get down to it, when you get into the history of the person who's a cheater, it has to do with family of origin stuff. And a lot of times it has to do with what you're talking about, Patty, that they didn't get something in their family of origin around attachment issues. And that made it easier for them to cheat. Uh, I also talk with couples, talk a lot about when we first meet, there's like a chemical reaction that we have with the person that is a new person, like bells and whistles. It's a kind of a nice.
Pheromones.
What'd you say?
I said pheromones.
Yeah, pheromones, but there's also another chemical reaction with the brain that's kind of similar to, the research around like exercise and that being a positive thing in terms of depression. So there's something similar that happens when we first meet somebody. It never happens again with the same person. So people oftentimes are looking for that in their relationship after time has elapsed. Like, well, why don't I feel the same sparks? You're not going to have the same chemical reaction with that person. You can have it with somebody new, which is what they sometimes will do when they're cheating, and they experience that and like, well, now I need to go with this person. Like, no, no, no. Let's analyze that, because it really is, it's about you having that chemical reaction with that person. But is that person the person that will be there long term? Is that person the person who is going to be committed to you? And people oftentimes do not unpack that and make serious mistakes in terms of their relationships with the present person. So I think all of those things, I think, have to be really investigated, explored with them, because I think most times people don't really, again, understand the impact of the family of origin stuff.
Thank you for that. So we've got two more comments. Renee, and I've unmuted you, Renee, and then Jenny also put a comment into our chat box. So,
Okay.
Renee, what else would you want to know more about for this couple?
Um, you know, since we're talking about LGBTQI, I think one of the main things that we would need to know is how each of them define the relationship, because there's so much variety in whether you're monogamous, whether you're, poly, and all these are newer terms that normal society does not have. But that would be because maybe they're both looking at it in different ways. If one of them thinks this kind of relationship is okay, whether they both want to be monogamous, and where they see it going, they may be just on two very different roads.
Yes, exactly. It's just some folks are open to having discussions around whether they want to have an open relationship, so being open sexually. Other couples may have conversations around being a polyamorous couple, where they have more than one person that they're connected to or in love with. But those conversations, I think, do need to happen, especially when infidelity comes up with LGBT families. Now, you can experience the same thing with heterosexual couples. There are heterosexual couples that have open relationships, polyamorous relationships as well. It tends to be, I think the research tends to support, at least currently, that you might see this more often with LGBT couples, but it is across the spectrum. And so I think that has to be a discussion that we need to have with this couple, and honestly with any couple. I've had that with heterosexual couples too, where infidelity comes up, or there are other issues that seem to suggest that they're not monogamous. But they have to have really open conversations around that. And that doesn't always happen immediately. People are oftentimes like not wanting to be vulnerable and own what they really want in terms of sex. And I think I said sexual orientation was one of the things that folks don't do assessment of, but it's also sex too. Like, people do not talk about sex. They just do not. And I don't know if I've had this conversation with Patty or not. We may have talked about this because we had a couple of conversations, but I teach a sexuality course. And in that course, I do a field trip, and I talk about it on the first night. And the very first time that I taught the course, I told them that we're going on a field trip. There were two older Black women in the class, and they were like, I can't go there. What if my pastor sees me? My girl, if your pastor sees you, I think you're good. Like, what is your pastor doing there? Your pastor's a freak too. So what do you say? So she went, she enjoyed it. She's on her phone with her girlfriend. She's like, girl, you never guess where I am. I'm in a sex shop. She bought cards. I mean, it wasn't like the experience that she thought it would be. But most times we don't grow up in families where we have open conversations around sexuality or sex in general. And so having open conversations around that with any couple, I think is important, whether they identify as LGBT or heterosexual, or on any of the spectrums, whether they're polyamorous or whatnot, because we're just not having those conversations. People are not feeling like they're open to it. And if we don't broach the topic, most times people will not talk about it. They just won't. So being really open about that. Consensual monogamy, are they wanting to, consensual non-monogamy, I should say, are they wanting to consent to having other experiences with people? Are they wanting to have experiences where they do threesomes, foursomes, whatever it is, and not being really judgmental about that? Because I think sometimes that comes into the room too. that we have our own background. And sometimes that may be related to religion, as we were talking about earlier, or whatever it is. Sometimes I work with people who, training therapists, have trauma around sexual issues. And so they are resistant to talking about any kind of sex at all. So knowing our stuff too, when we go into the room, being very conscious about that and working that out in our own therapy or supervision is extremely important. So what else? Other things?
Well, I was gonna, my questions were more around, and it's really close to what I think Renee was just saying about how I would want to know how each person actually conceptualizes what, quote, they say the problem is, you know, what they identify as the problem, and how they conceptualize that, which will fall into their cultural, you know, there's a lot of intersectionalism I think I got that going on here. Okay. You know, intersectionality, maybe I should say that, intersectionality going on here. So there's a lot of different like cultural factors and how they might conceptualize the problem, or, you know, what it might be, and how they've tried so far to work on something like this, either in this relationship, you know, even if like this other, you know, the infidelity had not occurred, maybe there was something similar in this relationship right now, or how they've handled this in the past, you know, where they've already gone. Because if they've already done something, you know, you don't want to go down the road again of something that they've tried, or that maybe they think they tried, but you're going to help them work at it in a different way. And you need to know that ahead of time.
I agree with that.
Those are my things.
Yeah, I would agree with that. I would agree with that. Really understanding like how each person conceptualizes the issue is really important, because there are the cultural issues. There's also an age difference too. It's not a large age difference, but in some cases that might have something to do with the maturity level. One person, the older person, Dwayne, is not out partying because he maybe had that when he was younger. And then Ruben is like, hey, I want to be in the club every night if I could do that. So there's age as well as ethnicity and background, teasing out things like, again, like religion, their views about sex and sexuality. Because even in LGBT couples, I think sometimes there's a conception that LGBT people are promiscuous and they're out having sex with everybody. But that's not always the case. There's a range within the LGBT community too. There are people that don't even like sex sometimes, or not interested in the same way that the stereotype portrays folks to be. So what do they believe about that too? That might be another reason why Ruben felt like he needed to go outside of the relationship, not condoning that, but explaining why he might have chosen to do that. So all of those things I think need to factor in. Substance abuse history. We need to ask questions about that, very detailed questions about substance abuse history. That's something that I think people oftentimes will leave out too, or not really assess really well. In California, I don't know if this is in Arkansas, but in California, marijuana has been legalized. Is that the case in Arkansas? Okay. You're like, no.
So we have a medical marijuana that is legalized, but as far as full legalization for recreational marijuana, absolutely not.
Okay. Well, here you go with California. So California is legalized after much debate. We've always had the medical, but now it's recreational, and people can go into. I don't know if folks have been to California recently, but there's shops that have popped up all over the place. And I'm nosy, so I have to go and see everything. Just have to be like nosy and see what people are doing. So I've gone to them, and they're really nice. Like they're almost like a jewelry store. Like they're glass cases and they're things that are displayed, and it's not like we would think. Like sometimes people, I think, have associated it be like a back alley where you're sneaking in and buying marijuana. That's not the case at all. It's like it's really upscale. So people, I say this because in California, I'm telling my students, like, you have to assess for that, because I think people will hear people say, well, it's not a problem for me. I smoke on occasion. You have to ask, like, what is occasionally? Because I know people who smoke. Occasional to them is they wake up smoking marijuana, they smoke it on their break, they smoke it on their lunch break, they smoke it when they get home, they smoke it after dinner, they smoke it before they go to bed. That's not occasional. And that is actually probably going to be diagnosable if we think about the DSM. So really assessing for that, like what is that, how does that show up in their relationship? Dwayne doesn't seem to endorse any kind of substance, but we need to ask him as well. And certainly it needs to be explored with Ruben, who is endorsing that and is in the clubs quite a bit. And you will see quite a bit of substance issues within the LGBT community. As I mentioned earlier, LGBT folks are at higher risk for those particular issues. And a lot of it has to do with the stress and this being a coping mechanism, maladaptive as it may be, but a coping mechanism for people to deal with some of the stressors that are associated with being a marginalized group. Does that make sense?
Absolutely.
Yes, thank you.
I'm sorry, I didn't hear you.
I said yes, thank you for touching on some of those really important things to consider as we move through this case.
Yes, thank you.
We got a few more questions
other
here.
Okay, go ahead.
No, I was just noticing you have a few more questions on this case study. I want to ask Ruben if he made a mistake according to his standards or views, or according to Dwayne's or others. So does Ruben feel like this was truly an issue, or is he trying to
Save
face with Dwayne?
Yeah, okay, I think that's a good one too, to ask him.
And even, sorry, I typed that in. And it's even, you were talking about the age differential. And so is this one of those, the younger, still in school, I don't know how I'm trying to say this, like where you're trying to stay within the standards, you're trying to stay within the rules. So I'm going to conform. Yeah, I've made a mistake because I need to conform. But, are we putting Ruben in the place of, the wrong person, when really that's where Ruben feels like he really is? Are we doing that to him? Is that our view? Like, you were wrong. Or, is he just trying to, like, I don't know. I would just want to know if that's his language or if that's somebody else's language.
Okay, so getting more information about that, I think, is a good thing. And then again, I think having really open conversations with folks about this, because I've had conversations with people where we talk about the possibilities of open relationship, and there's resistance. Oftentimes you'd be probably surprised, but it's by the person who's cheated. Like, no, I don't want that. Like, but that would give you the opportunity to have other sexual partners. I'm not talking about like other romantic partners. I'm not even talking about polyamory, and they're like resistant to it. But what is even that about? Like, why, if you are doing that to your partner, what is that about for you? Is it the physical? Is it the sexual relationship with other people that is intriguing for you? Or is it a deeper level issue that we need to discuss? Because I think both are worthy of further investigation. Other thoughts, other questions, comments? As related to that is the engagement. So with the SYMBIS assessment, there's research that's associated with the length of time that people have been engaged. So under 2 years is usually a red flag. If you've had 18 months, that's usually a red flag. So having some conversations around that. What does that mean? How did you come to be engaged? All that stuff, I think, was really important to investigate. Because sometimes, and I tell my students this when I'm teaching couples therapy, sometimes we're not going to help people to heal their relationship. Sometimes our job is to help them to split amicably, for them to part ways in the best way possible. And that's especially true when they have kids together, when they're married and have children. Like, how do you negotiate this exit so that it's not as painful for you, not as painful for the other person, and if you have kids, not painful for the kids, especially since those folks are usually connected for the rest of their life. So really having some discussions around like the relationship, how they came to be as a couple. I think a lot of times when we deal with couples issues or premarital counseling, when there are problems that come up, we focus on the problem and not so much about why people got into the relationship that they have. And sometimes those are really positive reasons. And I think those things also have to be important. So maybe Jenny, being engaged under 2 years is a red flag, yes. That really surprises me is the expectation for is the expectation for couples to be engaged for a longer amount of time? Yes. So according to SIMBIS, and this is one thing. There may be other literature that does not support this or conflicts with it, but I've seen this to be the case when I've used it with people. Within the 2 years, people don't know each other as well enough as they could if it's 2+ years. So that's why it comes up as a red flag on SIMBIS. Now, that doesn't mean that people shouldn't be engaged or married. What the red flag is about is having discussions about the issues that could come up as potential pain points within the relationship. Does that make sense? So, trying to think of a direct quote, but Will Smith and Jada Pinkett Smith talk about a conversation that they had with Ruby Dee. Ruby Dee, if you are familiar with Ruby Dee, is an actress who was married to Ossie Davis, another actor, and had a legendarily long relationship. And he tells this story, I think it was Will Smith who tells this story about Jada and he going to see Ruby Dee. And they at the time were having problems in their own marriage, Jada and Will. And Ruby Dee said, how long have you known him? And Jada says, I don't know, 17 years. Ruby said, that ain't nothing. Just keep, girl, you haven't even scratched the surface, basically. So 17 years, that really isn't anything. So the 2 years is a red flag because most people don't really know the partner really well. That doesn't mean that there aren't people that have been engaged for 6 months, get married, and their marriage lasts for years. That I've seen that happen too. But I think it's a red flag because people don't really know who they're dealing with in that 2 years. So there's stuff that comes out. If you've been in a relationship for longer than 2 years, you will probably know what I'm talking about. Like it could be 5 years and you're like, oh my God, I can't believe you're still doing this. Or I can't believe you did this. This doesn't seem like you at all. But we change and we evolve. And so I think those things are things that you want to talk about, especially in like premarital counseling, which lots of people do not do. I can tell you that too. It's a struggle for me to get people in there sometimes. Like, you absolutely need this because I know your family dynamics. Does that make sense, Jenny?
Yes.
Did that answer your question?
Thank you.
Okay. You're welcome. All right. So main issues. I think we've kind of covered some of those. One of the other things that we haven't talked about, I think, is PDA, public displays of affection, and how that comes up for LGBT couples. Heterosexual couples can do this all the time. They can, kiss and hug and touch in public without any ridicule or in some cases even being beaten or killed because of it. And so that's something that comes up quite frequently in work with LGBT couples and creating space for them to have conversations about that and how that will play out. So I know couples that don't care and they could be walking down the street in a major city and they're going to kiss and hold hands and hug and dare anybody to say anything about it and would be ready. They'd be on the ready if somebody physically attacks them. And there are other people, but even in that space, though, they're always on edge because you don't know, like if that would trigger somebody else's issues. And then there are people that absolutely will not do it in public. They just don't do it. But what is the impact of that on the person? And that's another example of minority stress. And so unpacking that and having conversations with people who identify as LGBT is important. How would you build rapport with this couple? What are your thoughts about that?
I think first and foremost is listening, to both sides of what they each have to say, and they're looking at both of their perspectives on the relationship. Just validating both of their experiences and being able to have both of them feel like they're being heard.
Yes, good. Yeah, so make sure that you're validating both experiences of each person. I would also add being very non-judgmental. I think that there are people that I've encountered who believe that they're trained in LGBT issues and they think that they can work with everybody. And then they say things to me and I'm like, I don't know if you should probably work with this population. So in Patty's introduction, she mentioned that I am a member of the American Psychological Association's Joint Task Force to revise the professional practice guidelines for working with, it was LGBT clients, but we've changed it to sexual minority clients. And that is the guidelines that most psychologists use. Currently, they are due to be revised. They do that every 10 years, and we are in the midst of doing that. And I joined that very much so because some problematic things that people were saying to me who had been trained by me. I remember having a conversation with somebody. We had lunch after she graduated, and she was talking about a friend of hers who identifies as gay. And she was like, I don't know what he's talking about. Like, you guys have rights now. Like, I don't know about discrimination. I don't think you're being discriminated against. I'm like, first of all, at the time, I think marriage equality was maybe 2 to 3 years old. So it's only 5 now. We just celebrated the 5th anniversary in June. And then there's all this stuff that comes up that people still have to deal with. But she's heterosexual, female, just doesn't register in the same way as somebody who has to have those experiences. And we hear the same thing when we talk about ethnicity and race. In June, with all the stuff with Black Lives Matter and the protests that we saw across the country and honestly across the world, people were like clueless. Like, what do you mean, Black people? You haven't arrived yet? No. There's still issues? Yes. And helping to unpack that for people and all of the history around that people don't really acknowledge or are clueless about. So understanding that and helping them to unpack that too is one of the things that's part of the minority stress model, as you will probably remember, is internalized homophobia and how that shows up. We haven't talked about that yet, but that shows up for a lot of people. And that's part of not coming out at work and not acknowledging your partner and not feeling comfortable with public displays of affection and other things that I've seen with people. And even in the infidelity, sometimes that has to do with that internalized homophobia and at a deeper level, more like psychodynamic level, at issues of attachment and rejecting people who you may feel may reject you because you feel inadequate, but not understand that at a conscious level. So having conversation, unpacking that, I think is important as well. Questions, comments about that?
I want to affirm that, especially when you think about the history that Dwayne brings with his deeply ingrained religious connections and how he might perceive himself as a gay man in this relationship. Kimberly says, is letting clients know if you are LGB a good idea for bonding? And if so, how the heck should that be shared appropriately?
You will hear different things on this. And I think I hear the same thing about race and ethnicity as well. My take on this is yes. I mean, if they don't know, like people know now about me. Like there was a time when I didn't personally acknowledge that, and that's a whole nother story. I don't know if we have time to get into that today. But I didn't come out until I was 33, and I'll leave it at that for now, unless you have questions about it. I'm open to answering it. But people know now because on the internet, I mean, the internet is a thing, and the internet has all these presentations that I'm doing on LGBT folks. I'm on the APA task force. Like, if I don't say that publicly, then people would assume it anyway. But on the website, it's how I identify as Black, gay, and Filipino. So people are going to know. So if I see people, they oftentimes will know that already. But if you're not out in that way, I think it's perfectly appropriate to talk about it. Now, as with anything, when we self-disclose, it's not about us. So I think you have to be mindful of that. It's not you telling your story. If people ask me about it, I'm not going to tell the whole story of my coming out process and all the stuff that I may tell you if you have questions about it. Now, if they ask me direct questions, yes, but it's not my session. So I'm not going to turn it into my session. And the same thing holds true, I think, with ethnicity and mental health. I had a student this semester who visually does not look Black, does not look African American, does not look half African American at all. Could in the old days pass as European American. I couldn't see it. Now we're doing in Zoom, so maybe if we were in person, it might be more obvious to me. But I could not see that at all. So he was presented on a case in which he was working with a young African American man who was unpacking stuff around George Floyd and the uprisings and all of those things. And the young man was talking about how he did not have African American male role models. And the therapist did not disclose until later that he was African American. Like, why would you not tell him that? Because you actually are what he needs to see. Well, I don't know, because people don't, sometimes people say, you're not Black and you're not Black enough and all this stuff. And I don't want to go through all that stuff. I'm like, no, you should not have to go through that. But I think there's something empowering about your client knowing that, especially if those are the issues that he's presenting with. So I think it's appropriate. I think it's appropriate. But again, needs to be shared when appropriate and making sure that we are not turning this into our session. Does that answer it, Kimberly?
Oh, perfectly. And I think a good component to that also is making sure that we've also done our own work to come to some kind of terms with our own racial, ethnic, sexual identity development or affectional identity development, where we are and where we stand. I think it's harder to understand and to put a thumb on how much self-disclosure we can make and how safely we can do that and open those conversations up for other people if we're not prepared to put a stopper on ourselves and to navigate that.
Absolutely. Thank you for adding that. I'm a strong proponent of us doing our own work. So I've had to do mine at first as part of the requirement for graduating from the California School of Professional Psychology. We were required, I don't want to say forced, but we were required to do it. I would say it probably was forced for me at the time because I waited till the last possible year to do it. It's like, I'm not about to do this at all. Because again, like they're growing up in a culture that doesn't really support it. I think those things have changed in the time that I've been in the field, but initially, no. And then the vulnerability that comes with that and having to open up and tell your own story to somebody and not knowing whether it be judged or not. But I have to say that it was one of the best experiences of my life. It was extremely helpful in terms of me coming out later on. My therapist challenged me in ways that I didn't think she would. We were very different backgrounds. She was 60-something, I was 20-something. She was an older Jewish woman. Her practice was in her home in Beverly Hills. I do not come from Beverly Hills, not yet. And so we were the opposite. But she was no joke. She did not play, and she pushed me to look at things that I normally probably would not have looked at. So I am a strong proponent of it. I tell my students that. I teach in another program in addition to the one that was mentioned, and that program requires a year like my program. I see those students be much more engaged with these issues than the students who don't do it. I don't think you can do this work and not have done your own. I just don't think that you're effective. So I think you're so correct in saying that. I want to underscore that. You've not done your own work. You must do it because you will miss things. You'll miss things. And it's not conscious all the time. It's probably unconscious stuff that you just don't want to bring to your own consciousness. And you will then not allow people to have that space to do that. Yeah. I don't think you can be effective. So thank you for saying that if I hadn't gotten to it.
Every good counselor has a counselor, Kimberly wrote into our chat. We are a little bit over time at 4:32. And so I wanted to give you some time to do some final comments before we got into any more discussion, because we could just go on all day.
We're at our time? Oh, that went fast.
It did.
Hey, I could talk to the dog all day long. Let me tell you,
I was just getting started.
I'm just ready to co-sign your comments. So
yes, I was just getting started. So let me wrap it up then, because I want to be respectful of your time, because I know y'all have other things to do today. So just in terms of strategy of supporting, connect people to social support. We know that's a protective factor. It plays out in the literature. We know it anecdotally. Make sure that people are connected to support, whatever that looks like for that particular couple or individual that you're working with. Empower the person, especially when coming out, if that is an issue for them. Empower them in addressing their internalized homophobia or heterosexism, because I think many people have that. Even the most integrated and accepting of folks, you will find that that comes up from time to time. And then connect them to role models. I have some role models who have been married or in relationship for like 20 years. They were actually married on the Grammys, if you remember that, by Queen Latifah, and have been together, and just a wonderful example of two gay men being married. I have some family members who are married, a lesbian couple, who are a great example of that. So connecting people to role models, because we don't see that. We don't see that in our communities. We don't see that reflected in the culture. I think it's getting better. It's Soul to Soul, we have been able to show some films. There's a Christmas film that I found that just came out that focuses on a lesbian couple that was shown in December. But you don't see it as much as you see those representations in the heterosexual community. So connecting people to role models, opening up the lines of communication with folks, connecting them to social support, all of those things are wonderful things to do for folks. So with that, I think I will end with this quote, and then if you can put up the slide for how folks can reach me if they have other questions or want other information about Soul to Soul, that'd be helpful. So Audre Lorde, who identified as lesbian, said this, and it's one of my favorite quotes. If I didn't define myself, I would be crunched into other people's fantasies for me and eaten alive. So we really want people to ultimately define who they are and embrace that, so they're much more comfortable. Happy people then will attract happy people in their relationship, and they will produce happy children. And that ultimately is what we want. And with that, I thank you for the invitation. Patty, thank you. Thank you, Arkansas Counseling Association. I appreciate the invitation, and I thoroughly enjoyed myself. And you see that I was not ready to stop. So I'd love to come back again. Thank you, thank you, thank you.